So, are you
But
ready?
the diseases like, you know, Meniere, some of the diseases that we covered, Addison's disease.
Okay. There's
Cush-
Addison's
Cushing-
versus Cushing's also.
Cushing. Yeah, Cushing's disease,
Yeah,
Cushing's
Cushion
syndrome.
and Addison.
Yeah.
That one, those two. Yes. So I will post.
Hodgkin's, you know.
I will post some of those for you. So you have that. So it will be good. So we will be very proficient. And message too. So anyway, let me see how the diabetes knowledge is. Let me share my screen.
Alex and Micah said their mic is not working.
Oh, how can they hear us then? Nice. Can you see?
Yes.
Okay.
Miami.
Who else is in here? Wait.
It's B.
Why is it B?
Because type 2 has causes poor wound healing.
See, diabetes. Everyone agrees?
That's from the video.
Hey, the video works then.
Yeah, it does. I mean, that's why.
Good. Do you want to wait a second? Wait. I wanna.
Was that right? I mean.
Yeah, that was right.
That was right. Okay.
That is right. There. Why don't I wait a second? Because why don't I post the videos on symptom of inappropriate and diabetes insipidus, and why don't I post it now, and hypo and hyperthyroidism, so you can watch them, because there's a lot of questions in your test about those also.
Yeah.
Oh.
Or do you want to go through the questions now?
Yeah, let's test ourselves. Let's go through the questions.
I mean, we can watch the video.
The videos later. Okay.
After,
And we go back.
Okay. So this one, the answer is
B.
B. Poor wound healing. You guys
Yep.
got it. This one, psoriasis. There's also a lot of psoriasis questions in this exam. What is it?
D. 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 D.
D for dog. Silvery
D for dog.
Silvery and white scales.
Psoriasis, silvery white scales. So questions like this, they're very specific, right? Questions like this, it's either you know or you don't. So it's just what it is. You should know, right? That's the classic manifestations of psoriasis. So it is thick erythematous plaques covered by silvery white scales. So P, psoriasis, possible treatments. Select all that applies.
Definitely E.
B, corticosteroids.
No.
Antibiotics.
Topical antibiotics.
Why antibiotics?
Topical antibiotics.
It's topical antibiotics.
Yeah, because
Why would
inflammation.
you need antibiotics for it?
To prevent or cure any infections.
For inflammation.
Inflammation.
Because the opening of the skin.
That is to fight.
Is there opening of the skin?
No.
No.
The skin is scaly, right? It's scaled.
But
it's scaly. It's not open. It's thick. It's red. It's erythematous. It's red. It's scaly. It's not open.
Oh, okay.
So
Are they able to do laser therapy on that?
But it's like a rash though,
Yeah,
right?
that's what I'm
like a
saying.
rash.
Mhm. So I mean, I only see the preparation.
I don't think laser. I don't think ultraviolet.
So we are saying that psoriasis is what? It's autoimmune, right?
It
Yeah.
is.
Okay. So what usually is the treatment for autoimmune?
Corticosteroid.
Corticosteroids, right? So we know
Steroid
that one is
treatment.
right. And very specific to psoriasis, this is also one of those questions where you have to know is, where we have to give them a bath, right? Remember, that's what it said in your book. You have to soak them.
Yes.
And what is that? It's A. It's tar.
Tar preparation.
I don't even know what it was.
And then it's ultraviolet light therapy.
Really?
Yes.
Yeah.
Yeah.
To
So
psoriasis.
it's A, B, and C.
So it's A, B, and C. But then make sure that whatever sheets you have it, I made you write a sheet
Oh,
of
select all
psoriasis,
that apply.
that it should be in there also. It should be. So, so the answer to that one is A, B, and
And
C.
C. So it's so sad, but I'm looking at this and I'm realizing that med-surg, you have to know them. If you don't know it, you will never be able to answer those questions. That's why I'm trying to find a better way of trying to get the material across. That's why I posted the videos for you.
yeah.
So, because if you don't know it, you're not going to be able to answer, right?
Yes.
Right.
That's an expectation that you have to know. These are not questions that are out there, but you have to know. This is also on skin, again. Skin carcinomas or skin conditions.
Skin cancer, right? So
So look at this.
Yeah, nurses.
Scan for a client who is nerve and color. Okay.
Malignant melanoma.
Why would you say it's malignant melanoma?
Because of the dark brownish and irregular.
Okay. Everybody agrees?
yeah,
Yes.
that's right.
Wow, are you sure?
Malignant.
I think it's C.
Squamous cell carcinoma.
Squamous cell carcinoma.
What else?
OC.
What is Kaposi sarcoma? What is that
Kaposi
associated with?
Is a cancer that affects HIV patients.
So HIV, right? When they
Yeah.
say Kaposi sarcoma, it's HIV. So, what is this?
Brownish.
Mm-hmm.
So the key word is brownish and dark and black color. Is that
Okay, with regular
I
shape.
think it's A. A body
meters?
irregular borders. Oh, it's A.
It is A.
Yeah, irregular borders.
Answer is
But excuse me,
A.
my own screen is not showing clearly. At least I can't see all the.
Yeah, we can't see
Yeah, that's why.
the questions at the
Yeah,
end.
I'm not able to
I
read
think
the
it's a-
question complete.
Well, maybe we need to move the picture, right? Sorry.
Yeah, it's covering it.
Where is it? Hold on a second. How do I?
No, we have to kind of play with the screen, so in order to kind of make the camera look smaller.
Your screen.
Yeah, and
Hold on a second. Okay, 1 second.
I think you're
You
fine.
know me.
Okay,
Yeah.
it's
Okay.
okay.
We
Yeah,
we,
you're
we have to
fine.
move
We
our
have to
own.
adjust.
Okay. But how's that? Is that better?
Yeah, we'll just have to get you
Okay.
there. Just you on the
I made it-
monitor.
Yeah.
Each one of us have to just have you maybe on the monitor.
I made that one bigger. So
So we
The
go
an-
for A.
A, because
Yeah.
anything, it becomes malignant melanoma, carcinoma, when it changes the pre-existing look. Remember that picture in the
Yeah,
in
it turns
the yeah.
brown,
Remember
right?
that
So,
picture?
so
There
it becomes
is
cancerous, right?
Right.
when it
Yeah.
changes the look of that from the previous thing, then it is a malignant carcinoma, right? Remember the picture, it was raised and it was brownish and all, whatever it is, if it's changing the shape of it, it becomes malignant.
Malignant.
So
Yep.
my very favorite question, diabetes insipidus.
Insipidus.
Can you guys hear me?
Yeah, we can hear
Yeah.
you.
Yes.
I can hear you.
Finally.
Yay! Okay.
Okay. I'm back.
That is C.
Insipid, yeah, C.
Yeah, urine output of 600 because it's supposed to be
Yeah.
C.
Because it
Per
causes
hour.
urination.
It's
Because your kidneys.
polyuria. Excessive.
Polyuria,
Uh-huh.
diabetes insipidus.
Yeah.
What is the normal sodium level?
135 to 145.
135 to 145.
So remember, in your MedSearch ATI exam, you also have to know labs, okay? You also
So
have to
the
know
values. Okay.
normal values. Yep. So answer A is correct. It's not the answer only because that is within
Normal range.
normal value.
Normal
Normal range.
Urine specific gravity. What is the normal urine specific gravity?
10 to 1.20
Two
to
to
As long as you know.
1.10 to 1.20.
This house is in the normal range.
So this is within the normal
Normal
range.
range. So blood glucose of 198.
That's
What
high.
does that mean?
It's high.
A bit high.
And
High.
is that an indication of diabetes insipidus?
Yes.
Oh, that is mellitus.
Mellitus.
Mellitus, right?
Diabetes. Yeah.
Diabetes insipidus does not what? It does not have elevations in blood
Sugar.
glucose, right? It has nothing to do with blood glucose, whether it's elevated or not.
That's-
It's mostly what?
Urine
Polyuria.
output.
Polyuria.
So this is Sagi Sid, right? This
Mhm.
is, what is that
Sid.
song?
Urine output of
Yeah,
650.
diabetes insipidus is PPP and IV, right? So urine output of 650 ml per hour because it is per hour. What is the normal urine output per hour?
30 mil.
30 ml per hour.
Oh, wow.
If it's 650,
It's a lot.
Ah,
it is-
Over.
it is a lot. So the answer to this one is,
Letter C.
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 so the urine output of
650 milliliters per hour.
The next question is, Dion,
A.
I want to check
I think
it
it's
again.
B.
Okay, let's see.
Yeah, check the
B.
glucose again.
Mm-hmm.
I think it's B because you have to
Check
observe
and
the
see what
patient
happens. Yeah.
before you do any other thing.
I want to check. No?
the answer is
B.
why B?
God,
Why
they have to check how low it went. If it went too low, Well, they have to give
But I
some.
remember, so I want to check it.
Yeah, because the glucose is low.
Isn't that C?
Oh, no, wait.
200 is
Fasting,
low.
See?
200 is
10 is not low.
the glucose is,
Level, okay.
Regardless, just to have a
The glucose is
baseline, we
high.
have to double check again the glucose level and see how
Right.
low it went.
Check it again to make sure if you forgot.
Okay. So
yeah, I
look
think
at
it's,
this. Okay. What is it?
B.
It's E. Now, this question is what? This question is asking you what your priority is. If you have questions like this, you have to look at all the answers are right. Usually, if questions are prioritization, they are giving you answers that are all right. You know, you have to give the client 15 to 20 grams of carbohydrate.
Yeah.
You know, you have to check it. You know, you have to complete an incident report. You know, you have to notify your nurse manager.
Manager.
Those are all right. But they're asking you, what are you going to do
first.
First.
Recheck.
You have to
Carbohydrate 15 to
What?
20.
You gotta check the glucose
Check.
levels first.
Recheck the patient.
You check the patient. You observe the patient.
so
I think you have to check it
okay.
first before you give the
You
glucose.
have to check first.
So
Right.
okay, prior to all of that, you guys were saying that yeah, because the blood sugar is low, it's gonna keep going low and all of these. What are you doing? You are making your own scenarios in your head. You're adding things to this context that is not there, right? It doesn't say the blood sugar will continue to drop. It doesn't say, it just says it's 120. You misread it. What are you going to do first? So when you're reading questions like this, do not take it out of context by putting your own scenario into it. Because sometimes we do that. At the back of our heads, we're saying, oh, because this is this, this is this, this is this. No. This is the question. This is just the question. So what are you going to do first? You do not assume that the blood sugar is going to go low. So how are you going to do it? Before you give it to them, you have to know exactly what the client's blood sugar level is, right?
Yeah.
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 So because you in your head you're anticipating that it's going to drop, but did it actually drop?
No.
And how are you supposed to know that?
You check the blood
Check
sugar
the
level of
Check
the
the blood
patient.
sugar level
Yeah.
first.
Yeah.
So you check the
What?
client's blood sugar level first, and if it's within normal, you continue to check the level by monitoring your client, right? Because in
Yeah.
the back of your head, you know that it's gonna drop eventually. But reading the scenario, there's nothing about dropping blood sugars. There's nothing there. It's just telling you, you misread it. What are you going to do first? Okay, so when you're reading questions like that, just
Miss Stephanie,
yeah.
don't forget the question is telling us that, I don't know, my mic is echoing. Can you please help me? It's echoing, like I'm hearing myself back.
Oh, you have an echo?
Yeah.
Yeah, it's okay. We don't hear the echo.
Okay, can you hear me?
Yeah.
Okay. Like in this question, it's telling us that you administer the insulin dose for the appropriate reading, a reading over 200. That means that you already assume that the blood sugar is high and you are trying to bring it down with the insulin. So it will continue to go down.
But you're anticipating that it's gonna go down.
Yeah.
But because you're anticipating doesn't mean that you're gonna give the client 15 to 20 grams of carbohydrate right away.
No.
Right?
Yeah.
Because they could go hyper also.
Yeah.
right? So even though I'm at 120, because remember, they did not say how much insulin dose you're giving. If they say that it's you misread it at 2, see, we're putting things into the scenario, okay? So if they're telling you that, yeah, you misread it, it's supposed to be 120, and you misread it at 210. So you gave the 20 units of insulin. Then you anticipate that it's gonna drop right away. But they're not saying how much insulin you're giving. They're just saying you misread it. What are you going to do first? So what are they trying to tell you is you want to make sure that the blood sugar is there. You anticipate it's going to go down, but it depends on how much insulin you're giving also. You could just be giving 2 units of insulin. So when you look at questions, just don't put your thoughts in there. Just it is what it is. Is that good?
So you check the blood glucose
So
level
the answer to this one is you check the client's blood glucose level first. If the blood glucose level is low, then you give them. If the blood glucose level remains to be at 120, then you continue to monitor by continually to monitor your patient, because you're anticipating that it will drop. How fast will it drop? You don't know, depending on how much insulin you're giving. But they're not giving you that information here. They're just saying, this is what it is. What are you going to do first? So you always have to check. With prioritization also, they're saying that the first priority, aside from your ABCs, right? Airway, breathing, circulation, aside from that, if they're asking you questions like this, you always have to gather data first before you do something. So here, you're assessing and you're gathering information before you do your nursing interventions. So I think we have beat up enough of this question. Okay, so the answer to that one is check the client's blood glucose. Next one, diabetes.
Okay.
So we're really going into diabetes.
Which of the following priorities actually?
Can I do B?
Can you do B?
B.
Why B?
Yeah. You should check it every 4 hours. Well,
why?
Okay, because it might drop.
Why will it
Well,
drop?
it's like they the question earlier, the priority first, right?
Yeah,
Mhm.
yeah.
So
Priority
so first you want to monitor the glucose level.
Yeah, and then you don't want to start consuming.
Yeah, you don't want to give
without
out.
checking before.
Yeah,
And you don't want to just take your usual dose of insulin just to take it. You want to make sure your test comes out right.
But every 4 hours, not too often.
Yes.
It is mellitus.
Is
Oh,
it?
take a use D. Oh.
You don't know? Okay. So
because
This is trickish.
okay.
because with type 1 you can't give 8 ounce because you got urination, right? So
But I think
with
Take
A,
as
you
usual,
put
but
more
don't there
sugar.
any other changes?
You're raising the sugar level if you give them carbohydrates.
Especially every 1 to 2 hours.
So
And if you give them insulin, you don't even know what your glucose level would be, you know.
So now you're in the right track.
I think it's between B and D.
So it is
Between B and D.
B and D are both right,
Yeah.
right?
Yeah.
So even though you're sick, because it says about sick day management, even though you're sick, you still have to take your usual dose of
Insulin.
However, as we said, prioritization, priority action is you're gathering data.
Information.
So
Yeah.
what are you trying to do? You're supposed to monitor blood glucose levels
Every 4 hours.
4 hours. Yay! What happens when you're, yes. So what happens when you're sick? Sometimes when you're sick, you're vomiting, you don't want to eat, right? See,
Yeah.
listen to me. I'm putting things into the scenario which is not here. So you still have to monitor your blood more often because you are sick. You're not feeling well. I'm just gonna leave it at that. And you still have to take your usual dosage of insulin. Only because in type 1, what is type 1?
Insulin dependent.
Mostly children.
Yes. Does the body, what? Does the body make insulin in type 1?
No.
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 So if you have type 1, you still have to take your usual dosage of insulin. Because your body does not make
Insulin. Yeah, the pancreas stops making it. So.
Yep. See? Yay. So no matter what it is, you still have to take your dosage of insulin, but you want to monitor your blood glucose more
Every
often
4 hours.
because you're sick. You're not feeling well. So that's that. See, diabetes is really, really good now. So.
Okay.
Now, dialysis.
Oh.
Very common.
Thank you.
In NCLEX as well.
Nurses.
Select all that apply.
Caring for this client.
A, B, E.
Yeah.
A, B, E.
Yeah. A, B.
Yeah.
A, B for sure. No, but the E.
E, yeah, because
A, B,
oh, check the graph.
C, E.
The graph, they mean the fistula, right?
Mm-hmm.
Okay, yeah. We have to take the
A, B, E.
Is there any graft?
The graft is the fistula.
Oh, okay. Okay, then he is right. A, B, E. A, B, E.
High A.
So you know your patient is stable.
Okay. But are you going to take the blood pressure on the graft side?
No.
No.
Oh, on the opposite side.
We're on the other side. Okay.
Yeah.
Why the client's weight? And when did they obtain the client's weight during dialysis?
Edema, fluid accumulation or fluid overload.
Before and after.
Before and after.
Okay.
Yeah.
Why before?
Before before if there is as a baseline.
The baseline, yeah.
Okay. So what happens in dialysis is there's a predetermined weight that the doctors do. Like they make a determination of what your dry weight is. So let's just say my dry weight it's usually kilograms. Let's just say I'm at 70 kilograms. It's what my dry weight should be. So dialysis patients, they weigh them before dialysis because if the current weight is 72 kilograms, it means that the amount of fluid that they're taking out during dialysis is 2 kilograms. So, do you get it?
Yes.
Yes.
So weight loss.
Yes. So because they don't also want to take more. So there's a delicate balance. So they want to maintain you at 70 kilograms. So when they weigh you and you're not observing your diet and your fluid restrictions and your pre-dialysis weight is 74 kilograms, it means they're taking 4 kilograms of water. But the dry weight is a determination made by the nephrologist. So that's why they obtain the weight. The most important weight to maintain is before dialysis. But they do it before and after. And they want you to be at 70 or close to your dry weight. Now, what about C? Verify the glomerular GFR, filtration rate. What about that? Why aren't you doing that here?
That's not part of the.
To make sure, at least, I think to be sure that the glomerular is functioning well.
Who gets dialysis?
People with kidney failure.
The dialysis technician.
Analysis nurse.
The patients that get dialysis are the patients that are in end stage, right?
Yeah.
Chronic kidney failure, right? They're in end stage.
Yes.
So if they're in, because dialysis is kind of like the last resort there. So if they're in end stage, is the GFR still working? No. So does it matter if we check it? Is it going to make a difference? No. So when they're already getting dialysis, it means that their end stage and GFR is no longer working. So C is not one of those answers. What about D?
No.
No, right?
I don't see a reason for that.
You're not going to give them a
Yeah.
add to the thing, right? So what about the graph side? There should be a
Sound.
a sound, a fluid or a thrill when you feel it. So the answer to this one is
A, B,
A, B.
A, B, and
E.
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 So there's no answer there. So A, B, and E.
E.
This one. I swear, if you get diabetes wrong in your test,
You put in too much pressure on
Oh,
Yeah.
there's blurred vision.
DGF.
what is this?
Type 2 is always blurred
Type
vision.
2.
Blurred vision.
Polyuria, blurred vision.
What did they say in the video?
Blue vision.
Low healing. So that's
A, B,
tiredness, blurred
Hypoglycemia.
vision, weight loss
So there's tachycardia, sweating, and blurry vision.
of hypoglycemia.
Hypo.
And no polyuria, that is for hyperglycemia.
oh, hypoglycemia.
Hypo. Is there polyuria?
No.
No. Not in hypo, right?
No.
Is there blurry vision?
Sweating for sure.
Yeah.
Blurry vision for sure.
Yeah.
What about tachycardia?
Yes.
No.
No.
There is.
There's tachycardia.
There's tachycardia.
The tachycardia is fast.
Huh?
Tachycardia is fast. You said hypo.
Mm-hmm.
Yeah.
Oh, yeah, what-
It is CF.
DCF.
EC. Is there polydipsia? What is polydipsia?
No, this
Excessive
is
testing.
mellitus.
Is there polydipsia in hypoglycemia?
No.
No.
What happens? You've seen it in the video, right? When
Yeah.
there's too much circulating glucose, what happens? There is polyuria, there's polydipsia,
Dipsia.
right?
Polyphagia.
Polydipsia, there's polyuria,
So B, D, F.
thrush, genital
BC, D,
BCF.
Oh no, B,
B,
C,
C,
F.
F, B, C, and
F.
F. So polyuria, polydipsia, and polyphagia are all signs and symptoms of
Hyperglycemia.
Hyper.
There's too much circulating glucose when there is no key. So
Wait, why is blurry vision still part of hypoglycemia?
Because
type 2.
Okay, what about type 2?
Type 2 diabetes is still high.
So blurred vision is on both.
One of the symptoms is blurred vision. So
Yes, I know, but
So
they
we
have
have-
manifestations of hypoglycemia. Isn't it because you have blurry vision because all that extra glucose is going into the fluid into your eye?
to your tissue.
No, it's like
So blurred vision is gonna be on both.
one of the
Hypo and
manifestations of
hyper.
It's on both. It's on
Okay.
both.
So
Hypo
blurred
I mean, I
vision
get
on both.
that. I
Write
get it.
down.
It's
I
just
didn't know
I
that.
don't understand why.
Yeah,
So blurred vision and everything
that's on both.
on both.
Yeah.
Yeah, it's on
That
both.
was tricky.
I mean, I get that. It's just that I just don't understand why when it's hypoglycemia.
You don't forget the manifestation of diabetes type 2, like retinopathy.
Yeah.
Okay.
So
Okay, we can move on.
Yeah, we can me off too.
diabetes again. Okay, I really
Right.
swear if you
I
guys
love diabetes.
if you guys get diabetes wrong, I don't know. I'm gonna get a hammer and hit you on the head with it.
Oh man.
What is
Oh,
this? Is
I think it's D.
diabetes.
D.
D. Why you can't shake the insulin vial vigorously?
No.
No, you rotate.
Can't freeze it.
It's gonna be
No.
C.
No.
What about C?
Didn't we?
No.
Word increase. No, wrong because of the word increase.
Isn't that very interesting? Did you remember how when you're exercising, it increases permeability on the cells and
Yeah.
then allow glucose to go in,
Yeah.
it out.
Yeah, permeability.
Remember? It's
Yes.
Yep, it's one of those things. That's why we keep telling type 2 diabetics, exercise. But is this right? I should increase my insulin when I exercise?
No.
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 You should? What is the right term here? Monitor, right?
Monitor,
Yeah.
yeah.
Not increase, but monitor.
Yeah,
You don't want to increase it
if necessary.
if necessary.
Yep.
Yay!
D.
So the answer to this one, the only right thing in here is
D.
D.
Insulin in the abdominal area.
Okay, diabetes, man. Okay, Cushing syndrome, my favorite.
And this gonna be cushion.
Isn't potassium?
Cushions.
Yep.
Sodium, raise calories.
I think
Look
it's
at
A.
the sheets that you have. Look at your notes.
Yeah, I think
Wasn't
it's A.
it A limited potassium rich food in the diet?
A.
Which of the following dietary modifications should the nurse include in this discussion?
The potassium.
A and B.
I think
B.
it's
Decrease sodium.
Because hypertension
But I
is
would go
triad,
for-
Cushing triad. So B
Cushing
for
triad.
sure. I know B.
What is in the triad? What is Cushing syndrome?
Limit.
The Cushing's triad includes the bradycardia, hypertension, and widening pulse pressure.
Okay, but what are the signs and symptoms of it too? What is going on in Cushing syndrome?
I think it's B. Because
Why is
when
it
you have
B?
hypertension, you reduce sodium intake.
Yes, but
It's
what is
very,
exactly going on in Cushing?
I think it's very
There is
very
hypernatremia.
low metabolism.
Hypernatremia.
Hypernatremia,
Mm.
right?
Uh-huh.
So
Or the
hypernatremia.
potassium is hypo. You don't need to limit it.
So because it is sodium and potassium, right? So if there's more sodium, there will always be less potassium. So in this scenario, when it says limit potassium, you don't want to limit potassium, right?
Yeah.
Because you are hypokalemic, right? Hypokalemia, but hypernatremia. So decrease sodium intake because you're already retaining fluids, right?
Yeah.
In Cushing syndrome, because your sodium level is so high.
Hi.
So what are you trying to tell your patients? You are decreasing
Sodium.
sodium intake, but you should increase potassium intake. Do you want to increase caloric intake?
No.
No. You're already heavy, right? Not increase calories, but increase
Potassium.
protein.
Yeah.
Increase protein intake, decrease caloric intake, carbohydrates, decrease sodium, increase
Potassium.
potassium. So the answer to that one is
B.
B.
E. So,
Okay. So
when does it peak?
It's 6 to.
is it PN, NPH is intermediate?
NPH, when does NPH peak?
10 hours.
So 12.
C.
4 hours.
C.
C. If
C.
you're giving it at 7 a.m., when does it peak?
6 hours. 8.
How many hours?
Well, what is the question talking about here?
The question is talking about
Is it the peak or the
Maybe
onset?
C,
of-
12:30.
if you give them 15 units of NPH. Remember we were talking about a peak effectiveness.
Onset, okay.
When does it peak?
Well, the duration.
Duration.
Is 4 to 6. So 12 hours is
What is the duration? 4 to
4 to 6.
When does it peak?
Hours.
How many hours?
6 to 10 hours.
How much? When does NPH insulin peak?
6 to 10 hours.
6 to 10 hours. What is the closest answer to this one?
Letter C.
D.
12:30.
12:30.
6. Yeah.
Oh.
15. D. 1500.
So, okay. So if it peaks from 6 to 10 hours, then you're looking at the closest answer to this one is D. Around 3 o'clock, you should give them a snack. Yes. Yes. But remember, okay, those are ranges. So like when you're looking here, these are just ranges. So you're saying that 12:30 is only 5.5 and it says 6 to 10. So you're looking at ranges and the closest one that there is, okay? Yeah, it's not for NPH. NPH doesn't peak at 4 to 6.
Yeah.
So but look at it. Because this
I
is
don't
the,
understand.
yeah.
Miss Stephanie. The range is between 6 and 10. So which
Okay.
one do we pick? Is it 6 or 10?
So any time that is between 6 and 10 hours is what you pick.
I don't see.
Yeah. So
Yeah.
this is 7 a.m., right? You're
Yep.
giving it at 7 a.m. So you're saying that 6 to 10 hours, right? So 7, 8, 9, 10, 11, 12. 12:30 is only 5.5.
Yeah.
Oh, okay.
Yeah.
Yeah.
So
Got
you
it.
just count.
Okay, I got it.
Yeah.
Thank you.
Sure.
So if that was 1,300, then we would have been paid.
15.
So the closest one.
So you give it at 3 o'clock. Military time, 1,500.
1,500, I'm sorry,
You
1,500.
just count, yeah. You just count.
That is 8 hours.
Yes.
Yeah.
So any time that is between your range is the one that you should pick. So you just count from the time you give it to 6 to 10 hours, whatever number fits here. And they're fond of using military time. Okay, so they're just crazy like that. Next one. So we said 1,500 is the answer.
Come on, Chris.
Cervical cancer. You guys know this.
Oh. B.
CA 125.
Oh, yeah, B.
B.
B, right?
Yeah.
Pap smear. Yeah.
Pap smear is the appropriate, is the diagnostic preferred method for detecting cervical
Cervical cancer.
is pap smear. Just for you, a CA 125 is to detect ovarian cancer.
Oh, okay.
Oh, okay.
A transvaginal ultrasound is to detect endometrial cancer. So, because you're going inside the uterus already with a transvaginal ultrasound, and an endometrial biopsy is to detect endometrial cancer. So this is ovarian cancer. Pap smear is cervical cancer. Transvaginal ultrasound is endometrial cancer. And an endometrial biopsy is also for endometrial cancer. So the most common thing that we're going to see in most of our exams is just a pap smear for cervical cancer. So that increased intracranial pressure. I hope you remember your cranial nerves.
Yeah.
Oh my God. Oh my God. Let me just go on
The third is
D.
What is the third?
Oculomotor.
Oculomotor is the third.
Yeah. So visual acuity.
So
B.
So a nurse is caring for a client at risk for increased intracranial pressure. You're monitoring the client for manifestations that indicate that the pressure is increasing. To do this, the nurse should check the function of the third cranial nerve by performing which of the following data collection activities. So if you say the third cranial nerve is
B.
Checking the pupillary response.
the oculomotor,
Yeah.
is the third cranial nerve. And how do you assess for that?
With
You check for
pen light.
you
Look in the pupils with the light.
okay.
Yeah.
pupillary response, right?
So light.
Yes.
Yeah.
Because what happens with increasing cranial
Dilation of the pupils.
the pupils?
Monique,
Okay.
go prepare.
Yep. So it has nothing to do with facial symmetry, right?
No.
Okay. It has nothing to do with the gag reflex.
No.
No.
And visual acuity is what cranial nerve?
That's gonna be the.
I think it's
second.
2.
It's 2.
Two.
It's tight, right?
Yeah.
You guys are good. Huh, we're almost there. Yay! So, okay. Intracranial pressure.
C.
C. 30 degrees.
Elevation of the bed.
Yeah.
Who said B?
It's C.
It's C.
Said your head.
Elevate the head.
Yes, and Charlie.
C for cat.
C for cat. So you're not gonna instruct your client to
Cough.
No.
You're not, what about a brightly lit environment?
No.
Oh.
So they need a
Right, you
completely
don't
dim, really dark.
Dark room.
Why would you elevate the head of the bed?
Leaves the pressure from
Because
Keep the pressure lower.
in the head.
And also it helps for breathing.
Hopefully by draining through gravity, right?
Yeah.
Yeah.
And it cannot be any higher than 30 degrees.
It cannot be any higher than 30.
Yeah, 30 degree.
Yay. So the answer to this one is
C.
Oh,
what
C.
is it? Yep, C. Now this one. Ray. What were we saying about this? You forgot this.
Oh, B.
A.
B for lung
Yeah.
infection.
B.
Or lung
B.
What about B? What is that?
B.
B.
GBS.
B?
B is
Yeah.
in boy.
Why?
I think it's
For
A.
GBS, you monitor for respiration.
You
No.
monitor for that? What
No,
is
it's,
Respiration.
Questions you should have the client. I think it's A.
It's A.
Yeah, because it's triggered sometimes by immunization. Many
No.
times.
But no,
Immunizations?
I think
No,
it's
B.
triggered by diseases like GI problem and things like that.
Yeah, but in now I
Well,
don't think
it's
it's for
triggered by an
respiratory,
infection. So,
Infection and other diseases.
but it's more with food, I believe.
It's right.
I think infection of the GI or something.
It is triggered by an upper
Respiratory.
infection.
Really?
Yep.
So the answer is B on that one?
The answer to that one is
B.
B.
there are conditions that are triggered by MMR also, but
As in
it's not Guillain-Barré. It's not GBS. GBS is more respiratory.
Respiratory.
Yep.
Oh.
So that is the end of it. So you guys are not.
That's all?
with that.
Wait, what?
Wait, no. There was
Out of 100.
What?
Keep going.
We only cover like diabetes and head and CBS. What about everything else? So that's it.
like
More diseases.
Wait.
I want a blood.
You had
Blood
what do you have?
diseases.
You have diabetes. You have diabetes insipidus. You have Cushing's. So with Cushing's, of course, there's always
Yeah, we did hemodialysis.
you have
Yeah, we still have blood diseases.
You will have with hemodialysis. You will also have peritoneal dialysis. Just remember, you
We didn't have
have
Addison's
skin
disease, though.
conditions. Yeah. So skin conditions are also in there. Reproductive. No.
No,
Sexually
we didn't.
transmitted.
No.
Yeah, HIV only.
Yeah.
We have something on
Oh,
blood
we didn't have
diseases.
sickle cell
Leukemia,
anemia.
You
Leukemia,
had your
Hodgkin disease,
anemias.
I can't hear.
Huh?
polycythemia vera.
You'll have
Parkinson.
mhm.
Sickle cell anemia.
Sickle
Yep,
cell.
systemic lupus.
Yes.
Then we
SLE
have
is in your task.
Burns.
What?
No, we didn't have anything with the bone.
Burns. Okay.
Oh,
Burns is in your task. SLE is in your task.
Cataract and glaucoma too.
Cataracts are in your task.
Meniere's disease.
Meniere's disease.
No, not Meniere's disease. There's none of
Multiple
that.
sclerosis.
Are you sure there's no Meniere's disease?
No MS. Guillain-Barré.
Okay, I'm taking that. Not gonna study MS.
There's psoriasis in there.
How about Parkinson's?
Acute kidney injury.
Insipidus, Addison's, Cushing.
Kidney disease. HIV.
No HIV.
No HIV?
No HIV.
No HIV.
No HIV.
pemphigus.
Should lessen that burden out.
Okay.
Or that really bad
Acute
one.
kidney injury.
I can hear.
Necrotizing
kidney failure.
fasciitis.
Huh?
Lynn can't hear any of us.
Fasciitis.
What is
Lynn?
it?
Necrotic fasciitis.
No.
Myasthenia gravis.
Myasthenia gravis. No.
Oh.
Parkinson's disease.
Gravis, but you have to know that.
Parkinson.
Okay, then can you just like do another like bullet point?
Yeah.
Yeah.
I mean like just putting it. I don't know.
Can you send more videos?
Acute glomerulonephritis.
The reason why glomerulonephritis, the reason why I'm giving you all those lists, because those are the things that you have to know for MedSurg 2. Now we're trimming it down because your exam is already on Thursday. But so I'm telling you, but because I know you already studied, hopefully, so you should have it at the back of your mind. But I will be sending you more videos that you can watch. Okay, so there's a lot of hyper and hypothyroidism in the test, but I will send you a video of that. So, and the good thing about the videos is you can watch them over and over and over. Okay, and take notes. Take notes of all of those. So I will post a video today about hypothyroidism and Addison's and
Cushing's.
It's the other one. It's DI, diabetes insipidus and SIADH.
SIADH.
Yeah. So I will post it right now. So I won't revise the list, but I'm telling you what is going to come. There's a lot of diabetes in it. So, but I bet if you still get diabetes wrong, I'm going to look at it one by one by one.
Get the hammer
get
out.
all the diabetes questions right.
Can someone tell me like where you could find the insulin onset, peak, and duration? Because it's always different online, and that's where I got it from. But I don't know where it is in the book.
Do you have the book or you have the templates?
I have the book, but it's like it's the online version. I downloaded it, so the pages are completely off. I just put like a chapter and I could search through it.
I know it's in my book. It's in 700 something, but it's a physical copy of the book.
Do you know a chapter specifically?
It's in the diabetes chapter. What chapter is diabetes in the book? It's endocrine. I know it's endocrine.
Yeah, I bet it's. I think it's
40 or something. Yeah, 40 something.
41.
It's give me the page right now. Hold on, show me.
48.
Sorry.
48.
48.
Mine's on page 1070, just so you know. It's table 48-1.
Oh, okay. Table
It's
48-1.
Yeah.
You just go to page 1070.
Yeah, my pages are completely off because I
Yeah,
have
so just go to go to table 48.
Sorry, Ewa.
Yeah, thank
Miss
you. I just
Stephanie.
needed a table because like it's completely different from online, and so I just
Yeah,
it's been
see,
messing
there
with
it is. It's James is holding it up. It's a table.
I don't see him.
Miss-
Oh,
Oh,
Miss Stephanie,
I got it.
yes.
is there gonna be like an adequate amount of time?
It's on the HEI platform. So, you know, it's only a minute a question.
Are we still getting 100 questions?
Yes.
That's not enough time.
No, a minute a question, remember. You don't want your HEI exam to shut down also. So, do you need more time? I only have
Yes.
2 other videos. No, not time for the test, but but
Yeah,
we can
let's-
move your final exam to Friday.
No. Let's do
No,
Thursday.
Okay.
We are okay. We
You're
are
okay.
okay.
Good.
I'm working
okay.
on Friday.
Okay. So I will post more videos. I have 2 other videos, and then I will find more videos for you, and hopefully by tomorrow I can post more.
Okay.
Okay.
So
Okay.
Yeah.
we start the test on Thursday at 5.
Okay.
It's all on the
God.
HEI platform. Okay. So the HEI platform, they have a different proctoring system. They call it Proctorio. They just switched it very recently. So just remember, on the screen now, I'm only the proctor, so I'm not seeing what is going on in your test, okay? But if they see that you're clicking a browser to open on your computer, they will shut down your test.
Okay.
So so just remember that they will shut it down. I won't see it. Okay. If it's little things like you make a mistake, you're clicking outside your browser, that's okay. But things like that, they will shut it down. And just remember that. And I can't retrieve that. Once they shut it down, it will score you at whatever score you were when it shut down. So just remember. And then also remember that internet connections, okay? Internet connections. You have to make sure that your internet connection is good for the 100 minutes. Because
my
when
God.
it's circling, there's nothing I can do because in my computer you're not circling. But if you're Yes, I'm talking about the test on Thursday because it's on the HEI platform. Yeah.
Oh, any interruptions in your internet could cause your test to be disrupted?
Yes.
Meaning,
So if there's
Oh,
like any other
I
test,
have really bad internet.
yeah, even in Schoology, if there's an interruption in your internet, the Schoology, it will stop too. It will hang you. So before when I was proctoring the old HEI way, I could tell you to log it off and then restart again. But now when you're logging off, they're telling you it's prohibited. I see it on the screen, on the student's screen. So it's getting crazy. So just make sure that you're in a space where you're not interrupted. Your internet is not, it's gonna be good for the next 100 minutes. Okay? That is just what I'm saying.
Well, wait.
So you would have to log into HEI.
Okay.
And that's how your test is going to be given.
And we'll be giving like a code like we did for HEI, like go in and put a code in order for them to open it and all that.
There's no more code.
Well, do we not?
Yeah. So once I will, on my screen, I will say, these are the following students that are taking this test.
Okay.
And it will just pop up on your screen.
Under my HEI or under testing?
Under your HEI. It will say under test or on your home screen, on your home page.
Okay.
And you just click on it.
What time are we taking the test? At 5?
5.
Okay.
Last time there was like
we got attendance,
like a lot of
we got
different.
homework,
Oh, sorry.
all this stuff. We got attendance. and
What was that,
homework.
Lynn?
This is helpful too.
What?
Lynn?
What?
I was asking about the homework and attendance. That has to help too.
Yeah.
Yeah.
Lynn's funny.
I have not closed that too. I have not closed your grades yet, but I'm pretty sure it will help you too.
Yay. Okay.
Yay. So
I just want to clarify that. What's the name? What's going to be the name of it in the test? Because last time there was like 3 multiple ones that looked exactly like it could be.
yes, it will say final exam MedSurg 2.
Okay, just
Is it on the test section or just the ATI platform?
It will see on your home in your page when you log in. You can see it right there. Or if it's not right there, it's in My Test, where you have your practice A and B. Yeah. So let's all log in. Get ready. Start preparing 4:45 on Thursday.
Okay.
Okay.
We have more time, and then I will give you my. I'm on your WhatsApp. So if you're having trouble on the test, text me there, because you don't open a Schoology app anymore, because they will automatically close you. It means there's another browser open. So
So don't have any other browsers.
no other browsers, or they're getting crazy, and no other devices, because they can sense it too. So ATI is getting crazier, but okay. It's good that we're already getting used to that on your final exam, because once you take your ATI test, that's going to be harder. It's good that you're adjusting already. Okay?
Okay.
If you don't do well on this final exam, am I gonna fail out of this class?
You better not fail it.
I'm just saying, like, what if it's not good?
No negative thoughts. No negative thoughts.
Well, you automatically are gonna grab our scores from ATI and then add it to what we have in Schoology, right?
Yes, but just remember, this is my exam. It's not an ATI exam. It's my exam. I just typed it individually on the ATI website, because I want you to get used to that. But it is not an ATI exam. This is my exam. And you have seen that exam, right? It's those questions. So it's my
one
exam.
that we just went over, right?
Yes. So it's my exam. It's not the ATI exam. I put it in there. I typed it one by one. So I just put it on the ATI so you can get used to that.
Can we get a sneak peek?
No.
Can we do 1 to 10 questions?
Can we do more?
At the end of the day, what is more important is that you learn something. So
Yeah. Send the
I will
videos.
carry that with you. So I will send the videos. Okay?
Okay.
Thank you.
Yeah. Thank you, Mr.
Okay.
Bye. See you on
guys.
Thursday.
Bye.
Bye.